think what's important is sort of to make sure we identify what we've learned about APS1, touch on the genetics and pathophysiology of the disease as we understand it now, and then briefly sort of overview the management and treatment, which we'll hear a lot more about in the next couple of days. So this is no surprise to everybody, but I think it's important to sort of outline exactly what APS as an acronym, we get tied up in acronyms sometimes, means. And of course, it's autoimmune polyglandular syndrome type 1. And as the name implies, that would suggest that it's really a problem with the endocrine system and your endocrine glands. But a lot of the discussion I think that I want to impart on today is that it can be much more complicated than that. And I think that has really important implications to the way we think about patients and the way we treat and manage the condition. So I think this is really well captured by going over a case. And I'd like to share a case with you of a 4-year-old girl with a history of low calcium and thrush. And really early on, she had problems. So at age 1, she developed recurrent episodes of diarrhea. Within the first 2 years of life, she had frequent upper respiratory viral infections and croup. She had been diagnosed with pneumonia. And as a result of that, she underwent a tonsillectomy. And during that peri-procedural setting, she developed seizures and difficulty breathing. So when the doctors assessed her, they saw that she had carpopedal spasms, or spasming of their hands and feet. She had a positive Schoffteck sign, which is hard for me to say, but and then Trousseau signs, which also indicate that she had low calcium. She had corneal ulcerations, thrush was apparent in her mouth, and she had small teeth that was deficient in enamel. They also noticed that on her hands, that she had soft nails with ridges and pits in them. And from this single presentation, she had a total of maybe 6 different manifestations just at that young age. So she had hypocalcemia, hypoparathyroidism, candidiasis, ectodermal dystrophy, likely keratitis with the corneal ulcerations, intestinal dysfunction with the chronic diarrhea, and the respiratory infections could be a little bit more complicated, possibly pneumonitis, but also maybe laryngospasm due to her hypocalcemia. And I think this case, what was really surprising to me is that this case was actually first identified in 1929. And even at this time, even though we've come a lot further along the way in our understanding of the disease, this really speaks to evaluating the whole patient and not really making sure you don't miss anything. And so we talked about what the acronym means, but I think it's also important to outline that it comes under many other names, including polyendocrine syndrome type 1, and APOSED, or autoimmune polyendocrinopathy, candidiasis, and ectodermal dystrophy. You can see why people just say APOSED. And what that means is really the diagnostic, try to help individuals with the diagnostic criteria, which, as many people know, is really dependent on 2 of the 3 major manifestations in the classic triad, which include candidiasis, hypoparathyroidism, and adrenal insufficiency. And these 3 things, they happen pretty early in life in general. Candidiasis happens usually, is one of the first manifestations to appear, but not in everyone. And the other 2 usually happen for most patients within the first decade of life. And they're pretty frequent in the population. So if you take a look at patients with this disorder, many of them, 60 to upwards 70%, will have these 3 diagnoses. But what's important, and as our case earlier illustrates, they can have a lot of other problems, including alopecia, vitiligo, hepatitis, pneumonitis, and so on. This diagram I like is because it really shows the kind of breadth and tissue involvement of this disorder, and really speaks to it being much more than an endocrine problem alone. And so this slide may be familiar to some, and I think it's an important one to go over. Patients with this disorder can have a very broad spectrum of disease. Upwards of 30 different manifestations have been reported, and some patients may even have up to 20 different problems, all related to APOSED. Once again, you can see that these 3 here are pretty prevalent, but within the patients that we've seen at the NIH, the GI tract, liver, skin, and salivary glands can affect up to 80% of patients. And